ήθελα να κάνω την εισαγωγή στην ομιλία της Προέδρου του κυρίας Κορίνας Πατέλη του FairLife, που είναι ο πρώτος σύλλογος σωματείο για ασθενείς με καρκίνο του πνεύμονα. Ένας νεοειδρυθής σύλλογος σωματείο και η κυρία Πατέλη είναι η ιδρύτρια και η ψυχή του σωματείου αυτού. Please, let's have the video.
Thank you very much for inviting FairLife to such an important meeting about the agenda in Greece in a post-COVID-19 world. FairLife was born 4 months ago to fill a gap, that of a specific organization dedicated to everyone affected by lung cancer in Greece. What inspired us to do this was my personal experience with my late husband, Simon. Simon fought an incredibly brave battle against this terrible disease, a battle that I dare to say we fought together each and every day, but unfortunately lost in August of 2020. Although Simon received first-class treatment throughout, his cancer unfortunately did not respond to chemotherapy or immunotherapy, and the only recommended therapy from all experts around the world was to receive a novel drug available then within a clinical trial. Thus, a quest began for the drug whose clinical trial was not available in Greece or in Europe at that time, and the USA was out of the question due to COVID-19. We made every effort in every direction to get the drug in Greece, since no comparable or satisfactory alternative therapy was available and Simon's situation was worsening daily. Unfortunately, we found out that even though innovative drugs are available within clinical trials abroad, they remain inaccessible for patients in Greece, both because there are very few clinical active trials in Greece, but also because of bureaucracy and the legal framework which poses significant obstacles. Simon unfortunately lost his battle, and I came to realize it was not only the lung cancer we were trying to beat. This inspired us to establish FairLife Lung Cancer Care. Our aim is to chart the lung cancer patient journey, to include the patient voice, and to bring together all relevant institutions in order to better address lung cancer. As described in the Economist report and discussed in details this morning, there are various aspects that need improvement in our country. We hope that the establishment of FairLife is indeed a step in the right direction to cover the gap of an organization dedicated to lung cancer, and we want to believe that the state on its own part will listen to the patient voice. I'm delighted to see that main objectives FairLife has set as priorities from the beginning are the subject of today's agenda. The first is a low-dose CT scan screening program in patients with increased risk. An early-stage diagnosis could save lives and provide more therapeutical opportunities and thus increase the survival rate. We hope that the reimbursement of the low-dose CT scan will be included in the ministry agenda as a priority. The second concerns the analysis of biomarkers on lung cancer. The importance of biomarkers on lung cancer has been extensively analyzed by experts, and the benefit is undeniable for the patient in order to receive a targeted treatment. The state is covering the cost of certain targeted drugs that are based on particular biomarker tests, without including the complete range of tests available. Consequently, it does not offer equal opportunities to those who cannot afford to cover the cost of a complete, comprehensive molecular analysis in order to get the right treatment, thus live longer and better. The coverage of all biomarkers is necessary, and an open discussion between HESMO and the Ministry is equally necessary and vital. For example, the coverage of NGS is a solution which can be economically advantageous for the national health system. Regarding the clinical trials, I understood from my experience that important legislative steps have been taken to speed up the approval procedure and in general to create a more friendly environment for attracting clinical trials in Greece. However, there is still a long way to go as Greece remains way below average with respect to the number of clinical trials. Finally, I would like to share with you our firm commitment to become the voice of all the patients in all the discussion with the interested parties. Our goal remains one, to do everything in our power to reduce the number of patients lung cancer can kill. This is the promise I gave to my husband. Simon was not given the opportunity to win the fight with this terrible disease, but let's hope that many others will have the chance to win. Thank you.